Okay, another protocol that's got some pretty significant changes is going to be the seizure protocol. So EMTs, routine patient care, don't restrain the patient, just protect them from injury. Suction the airway as needed. Consider placing an MPA to make sure they have patent airway. It says oxygen 15 liters via non-rebreather. Just oxygen titrate to maintain a O2 above 94. If you have to, assist their ventilations with a BVM if necessary. Protect the patient from injury, place on their side. The history preceding the seizure is very important. Find out what precipitated it, whether it was medication noncompliance, if they might have an active infection, if there was any trauma before the seizure, if they are hypoglycemic, if there's a possibility of substance abuse, or if they're in their third trimester of pregnancy. Also find out if the family gave diazepam rectal gel. And even it may not even be a rectal gel. I recently had a call where a patient was given 20 milligrams of intranasal diazepam by the family. So that may be something you see. So just make sure you ask the family and see if they give them anything. And determine if the emergency is related to an implanted vagal nerve stimulator. Ask when it was last implanted, or ask when it was implanted. Ask when it was last checked by a physician. Ask the current settings, history of magnet use, and changes in any seizure intensity. Make sure you check a BGL. If the BGL is less than 80, refer to diabetic emergencies protocol and request ALS intercept for ongoing or recurrent seizure activity. Advanced EMTs, IV access, administer fluids to maintain a blood pressure greater than 90. Paramedics, this is kind of where the changes come into place on this protocol. The dosages have changed quite a bit. So your first line treatment for any seizure is going to be 10 milligrams of IM Versed. That's if you don't already have an IV established. If you have an IV established, it's going to be 5 milligrams IV or IO. You can repeat this dose every 5 minutes up to 20 milligrams. If you work for a service that carries Ativan, you can do 4 milligrams IV Ativan repeated every 5 minutes to a total of 8 milligrams. Or you can do Valium 5 milligrams IV, then 2.5 milligrams IV every 5 minutes, so a total of 10 milligrams Valium. So the big one for us is going to be making sure you give that IM Versed if they're actively seizing upon your arrival. If they're in third trimester pregnancy, you can consider mag sulfate. We don't carry that here at AILC. If you need to manage their airway, do that as needed. Monitor vital signs, EKG, and pulse ox.